So Katie, let's talk. Tell me, what are some things that you really love about your face? What are some things that you'd like to work on a little bit? Tell me a little bit about what you're looking for. Well, Dr. Harlow, I'm a little bit nervous about Botox in general, but it's because my eyelids are really bunchy, and I feel like I can look really tired if my forehead drops at all, and my eyebrows drop, and my eyelids drop, and I sometimes I've seen Botox can kind of do that, so I really want to be careful with my eyelids. I want to look more awake if possible. I really don't like these worry lines. I really don't like those. So if I can get rid of those, that would be really good. Freeze that totally. I don't like the worry lines at all. But as far as my forehead goes, I have lines there, but I don't want my brows to be really low or my eyelids to be bunchy. And the crow's feet too, I don't love them, but I also really kind of, I don't know, I find that the lines, the upward smile lines, are kind of endearing. So I don't want to lose my ability to fully smile and have a wrinkle there when I'm laughing really hard. So if we could go maybe, I don't know, a little lighter there. I don't know, maybe we could just try a little bit there. That would be good. Okay, Katie, I think we can do a really great job just being conservative with you as I'm getting to know your face. We'll just low dose you, and we can always do more later at your touch-up appointment. If you want more, always can do more. Let's go really easy on your forehead. I definitely don't want to drop anything. I don't want to drop your lids. I don't want to drop your brows. I don't want to make anything sag. So let's just go low dose on your forehead. And then if you're unhappy with the wrinkles after we low dose you, you can always add more. It's not a big deal. But I definitely don't want to drop your brows. That's a high priority. As far as your crow's feet go, yeah, I mean, let's keep the upward smile lines for you. Let's just make sure that we soften them a bit so that they don't etch in over time. Let's just kind of make them so that you can still move and you can still make those creases, but you have to kind of really want to make those creases. Let's make those muscles a little bit more relaxed so it's a little harder for you to etch in those lines. For your glabella, for those 11s, the frown lines, I think let's be very aggressive. Let's really dose you up. That's the most important thing to you. So I think you're gonna need a good dose there. So let's put the bulk of your units for your frown lines, and we'll save the units elsewhere, and we'll kind of allocate most of your units for your glabella, and we'll kind of go light everywhere else. Does that sound good? Does that sound like a plan? Yeah, I agree. I think that sounds good. I think doing a lower dose today, I think that's really what I want. I feel comfortable with kind of just being conservative, so I think that sounds like a good plan. And yeah, let's go for it. I hope that gives you a little idea, my little interview with Katie, what it would look like for you to come in and have an interview before getting injections. It's so important to express to me what it is that you want. What do you want your aesthetic outcome to be? What are your goals? What are the things you want to avoid? I want to tailor your treatment to you, and I don't want to give you something that I want. I want to give you something that you want, or at least be as close as possible to what you are looking for. And sometimes we can get it perfect. There's an art to it. Sometimes it'll take us a few times, and we'll do a touch-up. I think always less is more, and we can always do more later. And in that way, you really get to be the one to direct your care so that we don't go over the top. We don't do something that you don't like. And I just want all of you to see that your opinion matters to me. And I really take the time with patients to hear them, to listen, and hopefully to provide care that is something you're going to be happy with.